We'll go ahead and call our August 22nd Benefits and Insurance Committee meeting into order. First, I would like to ask our Madam Clerk to call the roll, please.
Rebel Acton, Rhonda Allen, Andrea Anthony, Jim Bowles, Amber Brown,
Present.
Christy Crowell,
Present.
Mary Hickerson,
Here.
Deborah Kennedy, Lois Miller,
Here.
Alan McAdoo, Jeff Phillips, Doug Beaudry,
Here.
Shantae Sherrill, and Mayor Ketchum.
Here. Thank you very much, and thanks for attending, and our guests as well for attending today. At this point on the agenda is item number 1. I'll entertain a motion to approve the minutes from the last meeting. Is there a motion? Have a motion to approve. Is there a second? Second. And a second. All in favor of approval of the minutes signify by saying aye. All opposed? Motion carries. Next, we have item number 2, presentation of committee member candidates and vote of same. We have candidates, and I'll mention those in alphabetical order. Mr. Alan Farley from the Election Commission, he's here with us. Wendy Lampley is with the ambulance service, and she is out sick. We did have an email to our risk manager confirming that she was sick and would not be here. And then we have Cindy Mathis from the county clerk's office. I'm going to leave it up to the committee. Do you want to do voice vote, or do you want to do it privately? We have the forms if you want to do it privately, or we can do it by voice vote. Speaker Pro Tem Phillips.
Do these candidates need to be nominated?
Yes, they do.
I move that all 3 are nominated and we do a voice vote for one.
Okay. Is there a second? Second. Motion and a second. Questions? Discussion? Seeing none, you heard the motion that all 3 would be elected by acclamation, by voice vote. All in favor signify by saying aye. All opposed? Motion carries. Thank you. Next on the agenda is item number 3 is our financials. Our risk manager, Mr. Eagle. I'm sorry? It's only voting for one? Only voting for one. Okay.
The motion was to nominate all 3. I think we only have one opening.
One opening, that's correct. Okay. All right. Madam Clerk, are you ready?
I'm ready.
Okay. We will be voting for 1 out of the 3. All right.
Any questions about them, or
Any questions about any one of the candidates?
any of them to come up and speak if they'd like?
Okay. Well, Ms. Lampley, of course, is not here, but Mr. Farley and Ms. Mathis is. Mr. Farley, you're alphabetically. Okay. Ms. Mathis, if you'd like to come forward and come to the well. I think the committee would like to hear your reasoning of why you volunteered to serve this august body.
Thank you, Mr. Farley. I just want to introduce myself. I'm Cindy Mathis. I do work for the county clerk's office. I've grown up in Rutherford County. My mother was a teacher for 33 years, so I've been on county insurance my entire life. Today's actually my 8-year anniversary with the county, and I just think this is an opportunity just to give a voice and be an ear to the people in our office. I guess we probably are one of the larger offices in the county. This is something that everybody benefits from, so I just think it would be something good to be a part of. Thank you.
Okay, thank you very much. Any questions for her before she steps down? No? I guess you Everybody feel good about it. Mr. Farley?
Thank you, Mayor and members of the committee. I'm Alan Farley. I'm the Administrative Elections here in the county, and this is an important position, I feel, because one, it's a voice for the county employees, but also we have a fiduciary responsibility to the taxpayers. So it's a unique situation to where we're trying to find that balance and also take care of, I feel like, one of the great working bodies in our county as far as employment with all of our county employees. So I've actually come mixture of government and also private sector. I have some experience in insurance and HR in the private sector from past employment in years before. So I'm just here to offer my services, and I think that you've got some good choices, and so I think you won't be able to make a wrong decision. So thank you very much.
Any questions for Mr. Farley? Seeing none. Thank you, Mr. Farley. Okay, we're back with the clerk. We're going to call roll. You'll voice vote for one candidate. So it's Alan Farley, Wendy Lampley, or Cindy Mathis. Madam Clerk, call the roll.
Rebel Acton, Rhonda Allen, Andrea Anthony, Jim Bowles, Amber Brown, Christy Crowell, Mary Hickerson, I'm sorry,
Wendy Lampley.
Deborah Kennedy, Lois Miller, Alan McAdoo, Jeff Phillips, Doug Bodery, Shantae Sherrill,
Okay, we have 5 for Mr. Farley, 2 for Lampley, and 2 for Mathis. Mr. Farley, congratulations, and if you'd like to come on up and join this august body. Thank you. And thank you so much, Ms. Mathis, for putting your name into the hopper, and thank you for you're still welcome to come and participate and listen to all of our insurance committee meetings. But thank you for volunteering to serve the county. We appreciate you. Members, next we have financials from our risk manager, Mr. Elam. Mr. Elam, you're recognized.
Thank you. For the month of June in Fund 264, you'll see that there was revenue of $45,771,479 compared to expenses of $34,620,000. This is year to date, $689 for the calendar. The fiscal year, it is for the end of the month of June is $76,544,333 compared to $70,935,654. If you move to the next page to your spreadsheet, a couple of numbers I want to bring to your attention. If you look at the total enrollment, you have 6,126 with an average of 6,161. Your calendar year 2019 PEPM per employee per month expenditure is $936.81. One number I want to bring to your attention, if you look at the 2019 calendar year revenue versus expenditures comparison, for the calendar year, you will see $11,150,790. Keep that number in mind as we move through the next couple of months, and I will explain that a little bit. As we go down to the 2018-2019 fiscal year, you'll see we're ending that 2018 through 2019. So your revenue is at $76,544,302 compared to $70,935,653. And you have revenue less expenditures of $5,608,648. If you compare 2017-18 compared to 2018-19, the number right up above it, your revenue less expenditures, you see those two numbers are pretty close because last year it was at $5,768,451 compared to this year at $5.6 million. For the month of July, calendar year to date, you'll see $47,442,267 compared to $41,454,065. You move down to the fiscal year, you're looking at, and here's what I'm talking about, that 11 million number. You're looking at, for revenue, $1,670,788. Expenditures at $6,833,377. So as you move over to your spreadsheet, and we'll explain that a little more, when you look at the calendar year comparison, 2019, you'll see your number, revenue less expenditures at $5,988,201. When you drop down, remember that number was 11 million last month. So now it's down to 5,988,000. The reason for that is the Board of Education is on 10-month, when they're taking out their deductions for their benefits, it's on 10 months instead of 12. So you will see this number drop this month and next month, and then it'll start being collected again in September. So if you move down to the fiscal year comparison, it's the same thing that I just read out to you. The difference of those two numbers is $5,162,588.72. That's Fund 264 for July and August. June and July. Any questions?
Any questions, Mr. Elam?
If you could re-explain that Board of Education number to me, I'm not sure I caught it.
The Risk Management Office takes out of the Board of Education's paychecks, it's on a 10-month basis instead of a 12-month basis. So it starts in September. So as you get to June, there's no collection in July and August. So that's why that number drops drastically in July and August, and then it'll start picking up again in September for the 10-month.
So the people who are on 10-month, they're still covered during those 2 months?
Yes, they are. It's just how the premiums are collected.
So their insurance contribution is collected differently than people?
Yeah. Right, Lisa?
Same amount of money, it's just collected over, it's collected over 10 months as opposed to 12.
And they still
are covered July and August.
Yeah, they're still covered July and August.
Schools are on a school year, starting in September 1. It's prepaid. That's a good way to put it. They prepay. But I have a question.
Yes, ma'am. Ms. Nolan?
And I don't expect to answer now but I was just curious about this anomaly of May, why we're 110 more covered people. You know, it looks like it tracks along until we get to May. But they're not rehired in May. But that.
Okay.
So your question is, what is the spike in May? Okay. Mary?
Could it be based on the new hires for the new schools that go in? That would have been, you would have had some folks already started, but some of my friends have transferred over. So they may have, but then they had their spot filled where they left from. So did you hire somebody new to fill that spot that they left from?
I'll take a look at it. Okay, thank you.
Oh, that means we'll get back with you. Sure. Yeah.
I'll pull the reports and see.
Okay, thank you. Other questions?
All right, you want to move on to 266?
Yes.
If you look at the year-to-date workers' comp and OJI fund, you'll see 2018, 2019, $785,850.94, compared to last year at $771,228.51. So, as you can tell, finishing up the year-to-date, it ran pretty close to the same as the year before. As you move to the next page, it gets a little interesting. When you look at the year-to-date, 2019, 2020, you see that there's no expenditures there. Compared to prior year for that month, it was $81,927.96. What we did was, when MSI and Assured Partners changed, they went ahead because of the transfer to make sure that everybody got their workers' comp payments and things like that. Those checks were already written and then distributed. But the third-party administrator, Collins and Company, did not write any checks for the month of July. That's my understanding from their report. You will see this number most likely increase in a large way next month, in next month's report, because it's basically going to be 2 months combined. That's it.
Any questions for Mr. Elam? Seeing none, thank you for that report. Next, we'll move to item number 4, the OJI statistics. Mr. Good is not here, but Sandy Vu is benefits specialist. She's going to come, and you're a whole lot better looking than Dan. Thank you for filling in for Dan. Don't tell Dan I said that, all right? He'll shave his beard.
I'm Sandy Vu. I'm the benefits specialist in the insurance department. I am responsible for the county general, community care, and Smyrna Airport employees. Of course, Dan is out today, so he had asked me to step in to do the report for him. If you look at the May report, it shows 30 total claims were filed in the month of May, which comes to the year-to-date 117 claims filed for the year-to-date in May. And then out of the 117 claims, 74 of those claims were OSHA recordable. 33 claims were due to restricted dates. 15 claims were lost days, and 26 claims were all others. On the second page, we had a total of $7,321.17 paid for claims and $47,633.64 how much was incurred for the month of May. On the third page, we have a comparison in the graph showing 113 claims in the month of May in 2019 compared to 110 claims in 2018 and 94 claims in 2017 for the month of May. If you go to the fourth page, it shows the difference of money that was incurred over the past 3 years. In 2019, we had $220,000 that was incurred for the month of May, and $288,000 in May of 2018, and $343,000 in the month of May in 2017. Next, within that month for the Board of Education, there were 19 claims that had incurred. And out of that 19 claims, we incurred $16,501.34 for the Board of Education. For County General, we had 11 claims for the month of May and $31,132.30 total amount incurred. And then on the last page, it shows the broken down departments within the County General, which is Sheriff's Office, Ambulance Service, Solid Waste, and County Maintenance. If you go to the month of June.
And if I can help, hold on just a second. I want to apologize to the committee. We did June and July, and at the last minute, we realized that we didn't have a meeting for the May report. So she got it. It just didn't get copied off for everybody, so I apologize.
Sorry.
It was my fault.
But they have June, right?
They should have June and July.
Oh, okay, sorry. No wonder you guys are looking at me.
No, you're good. You're doing good.
Because I didn't realize I didn't have the numbers, can you just go over just the totals for May?
The total claims or total dollar amount?
Both.
The total claims in the...
Not broken down.
Okay, the total claims incurred in May was 30. And then the amount that incurred for the Board of Education was $16,501.34. For County General was $31,132.30. $31,132.30 for County General.
Ms. Stevenson.
I know Ms. Fu would be very happy, or Ed, to send this out to everybody, the report, right?
We will.
The May report?
Yes.
Thank you.
All right, if you flip to June's report, you will see a little different for this one. And the reason why is we do not have the expense report for June and July. As of June 7th, CMSI paid their last bills for any of the claims that we had. And then starting August 1st, Collins & Company paid any medical bills that were outstanding for June and July, but we don't have that report yet, so it's not included in the June and July as for today. So all I have is the claims. So in the month of July, or in the month of June, we had 15 total claims filed, which year-to-date for June is 132 claims. We had 85 total OSHA recordable. 36 claims were due to restricted days. 18 claims were lost days, and 31 claims were all others. On the second page, it shows a comparison to the previous years. In 2019 of June, we had 132 claims filed. 124 claims were filed in 2018 for the month of June, and 107 claims filed in the month of June in 2017. And on the last page, it shows the broken down between County General and Board of Education of the claims that were filed, of the total 15. If you guys would flip to the July's month. In July, we had 11 claims filed, which year-to-date, we had a total of 143 claims. 93 of them were OSHA recordable. 41 claims were due to restricted days. 20 claims were due to lost days, and 32 claims were all others. On the second page, it shows the comparison. In July of 2019, we had a total of 143 claims filed. 2018, we had 135. 2017, we had 116 claims filed. And then on the last page, it shows the broken down between Board of Education and County General. The County General was between Sheriff's Office and the Juvenile Detention Center. And that concludes my OJI report.
That conclude your report?
For OJI, yes, sir.
I'm sorry. Have a motion to accept the report. Question? Yeah, go ahead. Well, no, you go ahead and ask the question.
I noticed, looks like April.
Commissioner, you've been asked to use the mic.
I'm sorry. Couldn't hear you guys a while ago. I know darn well you can hear me. I'll do better. I noticed in April and May, there was a spike in both of those months over the prior years that were listed. Any particular trend that you guys have identified there as to what caused that spike?
Let me check with Dan, and then I can get the answer to you. I'm sorry.
If I'm not mistaken, this will also be presented at Public Safety on Monday night. Will you do that?
Yes.
I'll have it for you.
Will you do that
Am
presentation?
I going to do that?
Yeah.
I don't know.
No, I'm doing it for Dan. Dan's going to be out Monday also.
That question will surely be asked Monday night by that committee, if you'd be prepared to answer that.
That's a good question. Thank you. Our motion to accept the report. Motion. Is there a second? Second. Any questions? All in favor signify by saying aye. All opposed, motion carries. Ms. Vu, tell us about the QR code.
I'm going to have Chuck come up here with me to speak about the QR code.
Chuck.
Okay, so what we've done, communication is always an ongoing challenge to any organization on how to get information to the employees. You know, we tend to use digital aspects, we tend to use paper, we do word of mouth, things like that. So in the spirit of that, we have
Created a QR code, which should be a part of your package. So if you get your smartphone and go open the camera app and scan it to this code, it will take you to our quick reference page where it has the information where if you're out and about and you just want to know the Midpoint hours, their phone number, the Signal 1-800 number, or our office hours. It's just more a quick reference versus the website where it has the total full information on there. What I like about the quick reference is that it is not consumed with so much information. It just has the basic things that I would need as an employee if I wanted to call someone, or who do I need to direct my questions to, or answers that or questions that we get all the time. We have concluded that on our QR page. It's a working process, but it's good for right now that we have.
And this will help answer questions. You know, some of the big ones that we get out in the field are, what's the Midpoint number? Or what's the hours to risk management? Or where do I go to check my Cigna points? Those frequently asked questions that we typically get. This will be another way that someone can quick reference. And so we're out and about. We put a few on different areas. We're going to make sure we communicate this and get these QR codes out into the field as well. Mary, we got some for your team. But it's just another avenue of communication. So it may not be for you, but there are individuals that, you know, this will serve. And so this will be a really good addition and evolution of the program to be able to communicate that out. And so Sandy's worked extremely hard on this. And so she's, you know, she gets all the credit.
Thanks. IT'd help.
Is this the only form that it'll come in sticker, or they're going to be on like brochures and other?
Flyers and emails.
Yes,
And so
as
more to
much
come.
as we could.
I just tried it and it's awesome. It looks
Perfect.
good.
Yeah, so we're hoping this is the first phase of kind of moving into that and helping us be able to communicate it out a little bit easier to everything else.
Okay, quick question, because I'm not as savvy on these little things. But once I open this, can I save it on my phone?
You could. And then it also takes you back to our website if you had any more questions that were more detailed that the quick reference didn't have on there. So you could just go save it as a link and you can come back to it. But we've talked about it in the office. Put it at your desk, on the refrigerator, anywhere that you might bring with you. And then just if you lost the link, you can always just go back to it.
And after this, after the meeting, if we'd like to do a block instruction, we can walk you through it on how to use it and things like that too.
It's just a link to get you to something else sometimes, but like if you want to know what the hours of Midpoint is and you look on there and you're like, okay, I know what the hours are, now I want to make an appointment, you can just move on forward to the next one. It'll set you up to their portal and you can go in and make your appointment. It's just to keep from having to look up something and navigate through a website. It just narrows it down more, makes it quicker, and then when it answers that first question, it allows you to move forward to the next one. Let me say, OIT has really worked hard with us on this, and let me compliment them on this. And it's basically, other than using our OIT and printing the stickers, it's at no cost. So.
And the beauty of this is we can evolve it and we can change the information at will. Whereas with a form, you have to track down that form, you have to track down the flyer. With word of mouth, we have to correct, and we have changes to certain information. With this, we can modify it, we can change it, so as events come up or certain things, we can real-time feed this and keep it up to date. So this won't be one of those things where you get a website and then it's old information and it stays up there, we can't do anything with it. So we can really kind of touch this and evolve this. So again, this is going to be kind of the first step in an evolution of being able to kind of communicate a little bit more effectively to a wider audience. All smartphones after about like 2001 should have the built-in thing
to do it.
Camera. If you have one prior to that, you may have to download a little app to read the QR.
Tablets.
Yeah, and tablets. Tablets will work as well.
Yes.
Yep.
And can I insert one other thing? As you go through and you use it, I encourage you to call us, email us. If you see something that you think, we did this based on OIT's information of what sites were most clicked on and we had the most hits. So, we narrowed it down to the one. We don't want the QR code to be like the website. We're just trying to make it something really quick and convenient. But if you have any ideas or if you have something, that some type of change you think would be better, just please shoot me an email and we'll be happy to, take a look at it and see what we can do. I mean, this is put together for the members and the employees.
Any questions? Thank you, Ms.
Before Sandy leaves us, could I mention one thing? Sandy's turned in her 2 weeks' notice, and she's moving on. So I want to.
Congratulations.
She's been with the county 3 years now.
We're going to miss you, but I believe you're going to Vanderbilt. Is that correct? Yes. Congratulations, and get to go to school for free, and
I don't think it works like that. I wish it did, but it doesn't.
And they really liked her last name too, VU.
Yeah, Vanderbilt University, right? Yeah, thank you. Good luck to you. Next members, we have a wellness update. Mr. Chapman.
Hello, everyone. So for this year to date, for our Motivate Me Wellness campaign, Our last meeting was in May, so keep in mind that we've got 2 months worth of data coming in through this as well. But currently we're sitting at 1,419 annual physicals, 2,438 biometric screenings, 1,158 health assessments, 818 mammograms, 1,405 OBGYN screenings, 300 colon cancer screenings, 1,224 cervical cancer screenings, 265 prostate exam screenings, 1,700 flu shots. That number jumped up by 1 since the last report. That was an interesting little person in there. And then total to date, we have 2,720 completions for all 3 points for those incentive options. Now, traditionally, we will see a huge uptick in the last 2 months before we get to the September 30th deadline for this. So I predict a great jump of this by the next meeting that we have. With that, current and upcoming events. So we, since April, have been working at going out to all county general departments and speaking with employees, not just about the incentive program, but the benefit structure, answering questions about incentives. Sandy's had an opportunity to come out with us too to answer questions, provide information about upcoming enrollment, things like that. To date, we have seen and interacted with 800 employees since the end of May to now, and we're currently ongoing and meeting with Board of Education. We're finishing up with the last few county general departments as well. But to keep that in perspective, we've mainly focused on county general for the beginning part of this. Of the 6,770 employees that are eligible for incentives, around 1,200 of those are county general. So we met with 800 and physically spoke and interacted with these individuals to help them with their benefits, to answer those questions, to educate about the incentive programs. We've learned a lot of really good things, and it's helped us to process, improve our methods and things like that as well. But we've been really effective at getting out there and interacting with these individuals. Like I said, we're ongoing with Board of Education. We're actually going to be coming out to central office next week, and Lee Smith in our office just got back from 2 this morning, and so we're pretty much booked until September 20th, I believe, is the last day. So we're doing about 2 a day until we get to there. So we are really working hard to get out there and educate everyone as much as humanly possible about not just the incentives, but also upcoming enrollment, timelines, things like that as well. Moving on with that, the Life Services EAP webinar will open up on August 20th, and it's about effective budgeting, and that will be available on demand online at Life Services EAP starting August 20th. And lastly, the Rutherford County Wellness Fair. I sent out a communication this morning. I'll send out more and a shareable version. I apologize. The big one was just kind of a reminder. I'll send out some shareable ones, Mary, that you can post and things like that too. October 18th from 3 to 7, we'll be having our annual Rutherford County Wellness Fair. In addition to the normal activities and things, on-site screenings, mammograms, we'll have several vendors out there for health and wellness. In addition to that, we're conducting on-site open enrollment this year. So we'll have the Cigna teams available on-site. We'll also have the risk management teams available on-site. And if employees want to sit down and go through and look at what the best benefit options are, make the best informed choices, we have that option available this year at the Wellness Fair. So that will be a huge opportunity to actually get some of those questions answered and be able to make an informed decision on the benefits for the following year.
And Chuck, that's a first, right? We've never done.
First time
it's ever been done for open enrollment where employees can actually come in and enroll instead of trying to do it from home and peck their way through, you know.
That's a Lane Agribusiness Park in the back in the community center.
In the community center, yes. And I will have plenty of signage and information in regards to that as well. But just to put it on everyone's radar, October 18th from 3 to 7. And we'll communicate it. We're actually communicating it as well with the WOWs and the different areas as well as for that. And that will wrap up my wellness report.
Okay, we'll move on to number 7. Oh, I'm sorry, go ahead, Mary.
Just really, mainly for the audience, can you give us the deadline for the health risk assessment so that everybody in the world would know? And then give us the dates of the open enrollment, because I'm really getting asked a lot of questions, which it's that time of year. But let's just put it out there also so everybody can hear it, please.
Okay. So for the Motivate Me incentive campaign, the deadline to have all 3 points completed per person. If you have a spouse on the plan, they also need to complete 3 points as well, which would total for 6 if you have an employee plus spouse. 3 points if it's only the employee on the plan. Okay, dependents do not have to complete the requirements. Retirees as well do not have to complete it. That deadline will be September 30th of this year. And that everything has to. Now, if you have a claim, or you go out and you get a physical, as long as the claim date, the date of service, is prior to that September 30th deadline, things do take a little bit of time to process. But as long as that date of service is prior to that September 30th, that will meet the incentive requirements. And all employees are welcome to contact me or reach out to me, and I can double check just to make sure. Open enrollment will start October 18th at noon, correct?
Noon.
And it will run till November 1st at noon.
At noon.
And so those will be the time period. So you can reach out to the risk management office. Again, we'll have the on-site enrollment. And then again, this year, we'll have some Cigna tools and resources available to make informed decisions as well. More communications to come on those.
But I'll remind everybody, it's starting on the 18th at noon of October, but we're transferring over to the health fair from 3 to 7. So anybody that has any questions and wants to be the first ones on board, you can come to the health fair and they can take care of signing you up and do what you need to do. Anything you can ask, over the phone with us, you can come to the health fair and do it. We'll be moving people from the office over to there, preparing for that.
Open enrollment packets. When should we be expecting those, please?
No, because we have a meeting on it tomorrow to finalize it, and I think we're looking at the first week, like September 10th. So I think that's what's on the calendar. I don't have the calendar in front of me, but I think it's like September the 10th or something.
More to come.
Okay, thank you.
Yep.
Tanya?
Separate from what he was talking about, but if I'm remembering correctly, Commissioner Phillips asked for you to bring information to public safety. If I'm remembering correctly, we did public safety last Monday night, so the next one, I don't know if they did it early, and I look back in the next budget, it's not going to be for a few more weeks because we've already had the budget, so if you needed that information to get to Commissioner Phillips sooner. Your question was, why was there a spike in that month for accidents, and you wanted me to bring it to public safety, but they've already done public safety this month. They did it last Monday. According to the calendar, they did it August 19th. Mary and I both looked it up, and somebody from public safety called and gave me a question the day after public safety. So unless I'm confused, if I'm confused, I apologize, but I've misread. That's what I thought too, but I'm just check it. I just wanted you to know, just in the event it's already met.
I'll check, because I would be there by myself if it's not. Because Dan told me it was Monday, so I told him I would be there.
Public safety is 26, 5:30. Well, I guess the website needs to correct it, because I'm matter of fact, I just approved the agenda yesterday, and it's ready to go out. I think it's already been sent out, and I know, because I've already talked to the Sheriff's Department, they'll be there Monday night as well. And then Michael at Paul's, he'll have somebody reporting for him. He's got to have a little surgery, so he won't be there Monday night either.
Public Safety Committee meeting is Monday night.
Correct.
This coming Monday night, if that's the question. And if we don't have all those answers, that's okay. But at some point in time, they need to be asked. The spike could be something as simple as a larger number of employees. But what folks like me and probably Jim would be more interested in is the total incident rate, because it takes into account number of employees and hours worked. That's the type of thing that the committee is more interested in. And then if we see a spike, especially for 2 months in a row, a significant spike, and that looks like there's 25 more accidents over those 2 months than the prior years, what are we doing?
To correct
What
it.
are we doing about it? So that's the type of questions that we need to ask. And if the proper person is not there, it's okay. We can put it off till the next.
We'll be working on that.
He actually gave that report, I believe, in the April meeting, but I will go back and look at that, review it again, and then look at the numbers for you.
Any other questions? Yes, ma'am.
At the wellness fair this year, will there be, again, various booths one could go for voluntary screening?
So we'll have, we're finalizing the vendor list right now. Currently, what I have locked in, I have mobile mammography coming from St. Thomas, and then we're working at some other on-site screenings. I don't have them locked in as of yet, though, so we're still coming with that. Was there a particular?
Well, no, there's nothing in particular I was looking for, but I was just thinking about how we do 3 points, that everybody's supposed to get 3 points. And wouldn't it be great if we allowed people to earn a point by coming to the wellness fair and participating in one of these voluntary screenings? And so if they could come in, get their flu shot,
Answer that.
1 point, do their open enrollment and go to a voluntary booth and get a screening that they want to get, and that's point 2, and they only have 1 more point to get for the year.
To answer that, so the St. Thomas mobile mammography and the annual flu shots that we do at the wellness fair all run through medical claims, which count for your items. Yes, and we're trying to further get that going. Mm-hmm. Yes, and we're currently working on setting up some things to where we're trying to achieve that goal. So more to come with that. We're just working on finalizing that.
What I'm asking is, could this committee consider adding that as an additional way to earn a point? Because from what I remember, we created the list in this committee last time. So I'm asking the committee to propose, to consider it.
With the Motivate Me system, it's an internal Cigna system for giving credit through completions and things like that. So there are client administered options for that. The options are locked in for this year, but however, in future discussions, we could open something like that up.
Lois.
I have a fairly minor question, but just a curiosity. The Life Services EAP offering their online education, and for the month is effective budgeting. Do we track or have the ability to know how many
Engagement for
clicks that they get on that?
I believe they told us they could, so we just need to reach out to them and kind of get that information. We can look and see what that engagement is and kind of go from there.
It would be interesting to know which topics that they have each month that get the most interest, and it might generate other ways to get at the various problems or needs that the employees have.
Definitely. I'll run that back and we'll kind of see what we can find out and come back to the next meeting with that info.
Any other questions? Well, next is item number 7, and it says, did you know? And in talking with Mr. Elam, he asked if we could just have Mr. Chappa say, did you know this? And next month it'd be, did you know this? And you may not know. So it's kind of an educational thing, just a short snippet of what you think you know and you may not, that's covered in the policy that you might be able to share with your respective departments when you go back. Chuck, did you know what?
So the did you know for this month will be in the same vein as the flu shots, which is a good discussion to bring up. So with flu shots this year, we're starting to see early release of the capability to get flu shots. So CVS and things are getting them a little bit sooner this year than in previous years. So something to consider with your Cigna points to get you 3. Now, if you can get your flu shot prior to October 1st, it will go on this year's completion for your points. So it will count for 1 point for this year. If you get your completion or to your point at the wellness fair, if you completed at the wellness fair, it will go on next year's points. So if you have your 3 this year and you're already set, you will not receive credit for a flu shot completion if you have it prior to October 1st. Not if you have it at the wellness fair later, then it will count for the next year's points. So it's an option and a capability to earn your points. So something to consider as you're looking at your MyCigna accounts and you're looking at, you know, what you're going to complete and how you're going to complete it. If you need that 1 point, that is an option, certainly, but something to think in your head, you know, going into next year as well. That's something that you could receive credit for, so something to communicate as well. Ed, did I cover that pretty effectively?
Yep. Yeah. Any questions on that? Okay, that was helpful. Thank you.
Thank you very much.
All right.
That'll conclude all I've got.
Okay, that concludes your report. Next, we have item number 8, Midpoint Report. Ms. McNair, Premises Health. Did you know you're next?
Yes, sir. Thank you, Mayor. Good afternoon, committee. You'll open our Midpoint Report. You're going to see that we have 3 slides for this month at Midpoint. And I'm sorry, can y'all hear me?
Yes, ma'am.
Okay. You'll see we have 3 slides at this month at Midpoint since our last meeting was back in May and the last reported numbers were April. So I'm going to start with the most recent month, which is July 2019 for our total clinic visits. Now remember, these are face-to-face appointments in the clinic, and that totaled out at 1,391 for the month of July. 811 of those visits were provider visits. 58 were MA visits, and that's like lab work from a community provider, injections. We had 436 that came in just to receive the biometric screening, 16 occupational health visits, and 70 wellness visits. I would like to mention, you see that occupational health visit, something we started doing in this month is we started offering the rabies vaccine and titer to the PAWS department, and that was a new service that we started providing in the beginning of July. So just wanted to mention that there on those occupational health visits. Below that, you see our non-face-to-face encounters, and those are the encounters that we have with patients, members, families that are not in the clinic. And we had a total of 823 of those in the month of July. 142 are orders only. 187 were communication encounters, whether it be through the telephone or patient portal email. And then we had 494 results reviews with letter communication. You'll see that as a little bit of an increase compared to other months that I'm about to go over, and that's related mostly to the biometric visits. Every biometric that comes in and is completed lab work-wise, the provider reviews the results and completes a personalized letter to that patient. So you'll see that those go up as we see an increase in the biometric visits. Okay, if we'll look at the next slide, we'll go over the June numbers. June 2019, total clinic visits, we were at 866. 617 of those were provider visits. 94 were medical assistant visits. 93 biometric only visits. 9 occupational health visits, and 53 wellness visits. Below that, you see our non-face-to-face encounters at 577 for the month of June. And that was 128 orders only, 177 communication encounters, and 272 results review with letter communication. Yes, ma'am.
Does the occupational also include the Hep B?
I'm sorry, does the what?
Do the occupational health visits also do the Hep Bs?
Yes, so that would include hepatitis B, hepatitis A's, vaccinations and titers, as well as the rabies vaccination and titers. Yes, ma'am. Okay, we'll look at the next slide there. We'll go over the May's numbers. So in May of 2019, we saw 1,086 clinic visits. 889 of those were provider visits, 70 medical assistant visits, 64 biometric only visits, 8 occupational health visits, and 55 wellness visits. I did want to point out that when I say biometric only visits, those are patients that are presenting to the clinic only for a biometric screening in that visit. So we might have more biometrics than that, but they could have came in for a physical with the provider and also got their biometric screening. We wouldn't count that as 2 visits, so that may be included in the provider visit number that you're seeing on all of our slides. It wouldn't be 2 separate visits, it would just be 1. Below that, for the month of May, our non-face-to-face encounters is at 530. 144 were orders only, 186 communication encounters, and 200 results review with letter communication. Any questions over the visit slides? Okay. If we'll advance to the next slide there, slide 5, the what's ahead. We will be hosting walk-in hours at our Midpoint clinics for biometric screenings in September, and I have a flyer on the next slide there for our extended hours. We have sent this out via the email communication of Smart Steps. So September 1st through September 30th, so starting September 1st, we are going to do extended hours at all 3 clinics during the week, Monday through Friday at Blackman and Stewart's Creek from 7 a.m. to 8 a.m. Now, remember, we don't typically do walk-ins at our Blackman clinic, but for this month, during Monday through Friday at Blackman, 7 to 8, they can walk in for the biometric screening. Walter Hill, we host those on Tuesday, Thursday, and Friday from 7 a.m. to 8 a.m. And then every Saturday at our Blackman and Walter Hill clinics, we will be hosting walk-ins from 7 a.m. to 11 a.m. for the month of September. Back on the previous slide, the flu shots will be available after September 7th at our Midpoint clinics. I would like to just point out to kind of reiterate what Chuck was saying. So if you do need a point and you come and get your flu shot before October 1st, it would count for this year's points. And if you're thinking, oh, I'll just get a flu shot next September for those points, just be aware we don't really have any control on when the flu shots come into the clinic. We usually don't get them until later in September, early October. We were just very fortunate to get them early this year. So just keep that in mind when somebody asks you about the points. They're not always guaranteed to be here in September. So I just want to make everybody aware for that as they plan ahead for next year.
While you're on flu shots, that's for any employee?
The flu shots for anyone on the Rutherford County plan that can utilize our clinics can get a flu shot from us.
Anyone on the plan?
Yes, that is, yes.
Part-time employees are excluded?
If they don't have insurance.
Right.
Right.
Part-time employees are excluded even though they may spread around flu just like anybody else could. Does that make sense?
So the health fair, again, October 18th, we will have our flu shots available then. And then we will be hosting walk-in flu clinics in October. The first 2 weeks after the health fair, we will have walk-in flu clinics at our Blackman and Stewart's Creek clinics, October 21st through 25th, and October 28th through November 1st. So there'll be more information on that next month about the times and locations and all of that. So just wanted to make you aware that that's coming. And if we'll skip over to slide 7, as I've already kind of talked about our extended hours, on slide 7 there, did you know that Midpoint completes physical exams? So, as you know, as part of your ways to get your points for the Motivate Me incentive program is through a physical exam, which is actually a 2-point exam. We can complete that at any of our 3 clinics at Midpoint, as well as the Well Woman exams, the cervical cancer screening. We can complete that at our Stewart's Creek and Walter Hill clinics. Stewart's Creek is Monday through Friday, 7 to 12, 1 to 6 by appointment, and in Walter Hill, we do those on Wednesdays from 1 to 5. Okay, if you guys will follow with me over to slide 9, this is just our month-to-month trends with the numbers that we've already gone over with our clinic visits and our non-face-to-face encounters. And you'll see that spike in the clinic visits related to July with the increased biometrics. As well as we've seen an increase in our physical exams with our providers. So the next slide is our summary slide that is showing total operating costs. May, it was $217,146, and we saw a total unique member number of 847. June 2019, total operating costs was $306,935 with a total unique member of 680. And in July, $214,197 with a total unique member of 1,099. So just to explain a little bit more, that was 847 people that came into the clinic, unique people that came into the clinic at least once in that month. Same thing for June and July, so 680 in the month of June that came in and utilized the clinic at least once that month.
So if I'm reading this correctly, in June, you had 680 unique members, but your costs spiked to $307,000, which is a significant spike over all of the rest of the months, with the possible exception of December. Was there
Additional pay period. So we have 6 weeks of pay period in that month instead of 4, as well as you see the increase in May as far as the unique members. So with billing with labs, medications, all of that, were a month lag behind. So the unique members in May increasing with the visits, you're going to see that bill through June, a month later. So the 6-week pay period instead of 4, and then the additional visits for May. Okay, next slide there are incoming calls at Midpoint. So in May 2019, we had a total incoming call of 1,549 for a total average per day, or an incoming call average per day of 67. In June, we had 1,969 with an incoming call average per day at 98. And in July 2028, at an incoming per day at 88. Any questions? That concludes my report, Mayor.
Oh, thank you so much. Any questions for Shannon? Seeing none, thank you so much.
I have a question, but not for Shannon. Her numbers on the summary of the call sheet, are they reflected in the Fund 264, or should we add the $34 and some change? They're already in there? Okay.
Okay. Members, next we have the presentation of OMADA, Diabetes Wellness Program by Mr. Huffman and Mr. Perino.
Mr. Chairman, while they're coming up, let me ask school board, we have substitute teachers, correct? They're not full-time and they're not on a benefit plan of any kind, correct? Say again. So they're not eligible for our benefits. But what about the type of preventive care that we just discussed, flu shots, those type of things? I've heard the last couple of years of epidemics and whole school systems being closed down because of flu and those type of things. Does it make any sense that those part-time employees are not inoculated, that they don't have the preventive care?
They're not county employees. They're done by a third-party vendor, and it would make just as much sense to vaccinate students against flu.
That wasn't my question. My question are that these people are working in our departments and our schools, and what if they brought in the flu epidemic? I'm just saying we don't have a preventive situation for that to happen.
Yes, we do.
They deal with the public, they deal with our kids.
It's just the health system in general. Flu shots are these people can get insurance through other means. Private insurers, their spouses. We have systems in place.
Just a point. I don't know whether anyone has heard those same reports, but there were multiple school systems in the state of Tennessee shut down because of flu epidemics, and we're not ensuring that our kids and our teachers are protected from an outside influence. I've just got a concern about that. I'm not sure that we need to address it. We need to even be concerned about it, but I have a concern about it, and that's the reason I brought it up.
I think it's a valid point, and maybe if we were to kind of come up with a number times what it would cost, it all comes down to cost, what it would cost to inoculate all those assistant teachers and part-time teachers, et cetera. But some I think we could look at. Any other questions?
The only thing about that, I think we would have to come up with another mechanism by which to pay for that.
Correct.
Because the members that are part of our health insurance plan should not have to absorb the cost to, so it'd have to be another mechanism of paying it, maybe not running it through the insurance fund, but running it through the HR's budget or somebody's budget, other than insurance.
You'd have to find another source of income to pay for that.
Christy was making, was that they're not part of the membership.
All valid points.
If one of those substitute teachers showed up for a flu shot when they're on site, would we turn them down, or would we make them pay? Why can't we make them pay? That's just it. I'm just saying we're turning them down. There could be an opportunity for us to do something. I don't care whether they pay it or not, but some of those folks may want a flu shot and they're not going to get it unless it's readily available to them.
Ms. Nolan.
I guess when you talk about the school system, I think it's, am I here? Okay. What do you do with all those little children who are not vaccinated with flu? I mean, I guess I'm just carrying it to the next level. That's where I think that you got your sickness.
Okay. Any other questions? Gentlemen, you're all recognized on your report. Thank you, Joe.
Good afternoon. I'm Paul Huffman, Senior Account Manager with Cigna, and Mr. Elam and Mayor Ketchum asked that we come and present to you some information regarding a new provider that we have contracted nationally that delivers diabetes prevention to our members. And I'm going to introduce you to Nick Perino with a company called Omada. And like I said, this is a new company that Cigna has contracted with. And we want Nick to kind of walk you through the program, what's going to be available to your membership. But we also wanted to get your buy-in and your approval on this before we flip the switch, so that you know what's going on and you know the communication that's going to be going out to your membership. So with that, Nick, I'll let you walk through the brief presentation that you have in front of you. This one.
Well, thank you all for the opportunity to be here. I think this is an appropriate time to say my name is Nick Perino and I approve this message. So what we wanted to do was just to kind of further elaborate what our relationship is with Cigna and how we can help identify a big portion of your population who might be at risk of developing a chronic disease like type 2 diabetes or cardiovascular disease. So as Paul alluded to, Omada Health is considered a provider of healthcare. We have a clinical program that we provide to employees and dependents who are on the Cigna health plan that help to prevent diabetes, cardiovascular disease. So how we do that is that we contract it nationally with Cigna. This is already part of your benefit. Since you are contracted with Cigna, it's already there and it's ready to kind of be rolled out to your population. We just have to have the approval to do so, kind of like the okay to turn on the switch. So a few things to kind of talk about. One, this is considered a preventative service. Therefore, there's no out-of-pocket cost for your employees or the dependents who are on the health plan. And then secondly, there's no real need for a contract for you all. It's already embedded, so there's no contract, there's no RFP process that's needed, so it makes it really quite simple. Any questions on kind of what our relationship is, or Paul, Mr. Huffman, did I get that okay? Yes?
Paul knows I got a question.
Okay.
Let me just make sure before you go any further. This, we're already paying for. We just got to tell you to turn it on.
No, we're going to go into how it's paid through as a medical claim.
Yep.
But there's no administration fees for it.
Correct.
Yeah.
Oh, okay. Yeah. So there's no additional admin?
There's no.
It's a claim sheet?
Correct.
Okay, thank you. That helps.
Yeah, that's a great question. I failed to mention that. So this is all funneled through claims. It's a medical spend. So if you guys open up the presentation, I'll try to be brief and ask any questions you may have. This is kind of the state of where we're at in the United States. We do work with quite a few clients in the state of Tennessee that are public entities that we've already rolled this out to, that we provided some really good success. But what we have found, I've heard today a lot about your wellness strategy and how you're trying to get people to do their wellness screenings and whatnot. But the biggest issue we have in the United States that we have in the state of Tennessee is that there's about 90% of people who have prediabetes today that don't know that they have it. So one of the solutions of the Omada program is that we can help you all identify in a private manner with your employees and dependents who would be at risk, who would be eligible for this program. Without intervention, we know that 70% of these people with prediabetes will develop diabetes, and it's going to cost you a tremendous amount of money. So that's really the focus of our program, is how we can get these people into this program that is verified by the Center for Disease Control, and then to hopefully prevent them from developing diabetes, cardiovascular disease. Moving on to the next page, I don't think it's numbered. This shows you what our program kind of entails, if you will. This is a digitally delivered program. So it makes it accessible to anyone, no matter where you're located, no matter who you are, what type of job you have, what time of day. At the end of the day, this is a behavior change program. We have about 11 studies that have been performed on the program that shows that it works. We have over 250,000 participants in our program that have gone through this to showcase that it does work and it prevents chronic disease. So what they do is we help participants apply meaningful changes around eating, activity, sleep, and stress. We're letting them know how to make these small changes as they're going through this program. So if you look up in the blue section, if you will, every single week, for the first 16 weeks, we provide a new lesson, an interactive lesson, an applicable game that goes along with it to help you kind of cope and figure out ways to manage your disease state currently. We also provide every single person a digital scale with a cell phone chip in it. So we embed their profile into the scale. We send it to that participant when they start the program. So it starts to help them create habits of waiting on the scale, being cognizant of their weight loss as they're going through the program, and then most importantly, we don't charge unless there's an actual weight loss that occurs, which is a per % weight loss. So it kind of makes us aligned with the financial aspects of our clients. There's about 30 to 35 people who go through this program with them virtually. This is all done through either the app, the Omada app via Cigna, or you can do it on the computer if you need to do it on a computer. And then we also assign everyone a health coach. So this health coach is an employee of Omada. They're there to guide the participant through the program, answer any questions they may have, encourage them, and really to help keep them engaged to go through the course of this year-long program. And then as well, they're uploading their activity and tracking their food. Any questions on kind of what the overall picture of the program looks like? Anything to add? Okay. So this is a clinical program. There's a clinical eligible criteria. So as we are marketing the program, we co-brand this program with Rutherford County. We will create a specific web link for your employees. We can put it on we can kind of use a QR code. We can add to the QR code that's recently been launched. We can add it to your intranet page. So basically, it's a CDC-approved risk screener to find out if you're eligible. Because again, 90% of the people who have prediabetes don't know if they have it, so we have to help you all identify who those individuals are. So if you look to the left, the inclusion criteria is for anyone 18 years or above on the health plan. They have to have a BMI of 25 or above, or 23 or above for the Asian population. And then you have to have one of these risk screeners, one of these other risks, which is prediabetes diagnosis, high triglycerides, low HDL, high blood pressure, and high blood sugar. So we're asking these questions in the risk screener. We're identifying who they are, and then then they're able to start the program. So, any questions on the eligibility? Yes.
I noticed on the exclusion criteria it says customer opt-out.
Yes.
So Cigna gives you medical information about our people, and then you contact them, and then they opt out?
It's more of a Rutherford County opts out rather than the employee opts out of the program.
Okay, say Rutherford County opts in.
Yes.
We opt in. Do the people who have insurance through us, do they have to opt into the program or opt out?
Go ahead.
So they would have to opt in. So we're going to get an active participation from that member to fill out the risk screener. And then when that risk screener identifies them as being eligible, then they would have to actively register and be a part of the program. So you
would maintain all of their medical information until they give you permission to opt them into this program. And once they give their medical information to you, how do you keep it safe?
Yeah, it's a good question. We don't, at the time they take the risk screener, we don't know who that person is. just for your information, as I mentioned earlier, we're considered a healthcare provider, so we strictly adhere to PHI, to the HIPAA rules and regulations. So we don't do anything with this data. We also have part of that relationship with Cigna. We have all those mechanisms in place.
That was part of our vetting with choosing this provider, is that they do have the safeguards in place and the firewalls to protect the data from any source of access, and then
They meet Cigna standards for.
correct.
Yeah.
Correct.
Yep.
Okay, so you just said that the patient has to opt in. And then I want to make sure I heard you correctly. So they have to reach out to you in order to get the risk profile done. And you're not screening a screen isn't done through their medical data to see if there specifically could be a problem. In other words, if they've hit one of these other items and you're not outreaching to them, they have to recognize themselves that they may have an issue and they reach to you. Is that what I'm understanding?
Both.
Yeah, it's kind of both. I think I didn't clearly state this. So what we do, if this kind of helps kind of guide along how we do the actual outreach. So we are outreaching to your employees. Everything that we do is approved by the county. So through this marketing effort, whether it be on your internet page, so we'll create a customized web link for Rutherford County. We can tag on to your wellness events. We can provide documentation, some print-offs as well. But it just drives employees to this web link that we created specifically for Rutherford County. Then they go and they fill out this risk screener that comes from the Center for Disease Control to find out if you're eligible. Once they do that risk screener, then we let them know immediately because they give us their whatever preferred email address or contact information. Then that's when we outreach to them and say, you are eligible for the program and it's time for you to apply. So participants, employees can add onto this. They can take the risk screener anytime throughout the year. This is an ongoing benefit. So that's kind of how we do the outreach. And then as Paul mentioned, it's kind of both because we are connected. We are getting, we're able to do some targeted outreach to those individuals. But again, if we go back and think that 90% of these people don't know they have prediabetes, it's really good to do the risk screener as well. So that's what I would say every single government agency in Tennessee that we worked with all do this online risk screener.
And those with diabetes would be excluded from the outreach.
That would be correct.
Because this is a diabetes prevention program.
Yep.
So how long is this program? I know you said it's continuous, but I'm assuming that no one can just hop in the program and come out. They do it for 1 month, and I'm just trying to get a better understanding of that because it's not resignating.
Yeah, that's okay. So the program, it's broken up really to almost to 2 years. The first year, if you look at the participant experience, it's broken up into really 2 components. The first 4 months is really kind of the true diabetes prevention program where they have a new lesson every single week. But the whole course of the year, they're doing everything that we had just talked about on this page here. So they're continuing to do that. About 80% of the people who start the program, that first four months, complete the program. At the end of 1 year, there's about 62% of people who are still actively engaged into the program. And then depending on their level of comfort, their success, then they tell OMADA, they'll tell us that they want to continue the second year, and then they continue on to the second year. So it's just, it's a behavior change program, so we're helping them make these small changes throughout the course of the program, because we know there's no magic pill. There's no magic pill that's out there that's going to help people prevent. The best way to do it is through actual education and behavior change.
So for ultimate success in this program, what's the time commitment? So if I'm, interested in this program and I want to have these changes, what would be a time commitment? So if I can see, is this really a benefit for me?
Sure. It's very limited as far as a time commitment. So here's the first 16 weeks when you're doing those lessons, they take about 10 to 12 minutes to read. They're very simple, easy to digest information. I think it's written like a 5th grade reading level, but again, just really easy to understand. So that's a time commitment for the first 16 weeks. You're automatically uploading your activity through your Fitbit or your smartphone. You're tracking your food, so you're taking a picture of what you're eating for breakfast, lunch, and dinner. And if you're using the app, that's automatically being uploaded. So in all, I would say for the whole week, it would probably take you around 20 minutes, 20 to 25 minutes, but you're communicating with your health coach. So if you develop a really good relationship with your health coach, you're communicating with the health coach as well. So it really depends on the level of interaction that the participant will have with the health coach and the people they're going through the program with. So it's limited. Yep.
Maybe you covered it and I didn't hear it or didn't understand it, but 84 million people, 1 out of 3 maybe have pre-diabetes and doesn't know it. How many of those will develop diabetes?
Great questions. 70% of the people with prediabetes will develop diabetes without some meaningful type of intervention. So
this program that you're introducing, if someone who has prediabetes and enters the program, what are their chances of not having diabetes?
Yeah, it all kind of depends on your level of success. So one of the ways in which we measure success in the program is the per % weight loss, which we're capturing from the digital scales that we send. So from statistics and prevalence standpoint, we know that for every 1% weight loss, that equates to about a 10% reduction in the risk of developing diabetes over the next 5 years. So even like a 1% weight loss is meaningful. But we have statistics. This is all based off of a trial that was done by the CDC that showed that behavior change reduced the risk of developing diabetes by about 64%. So we've applied that to a digital program that's in person versus digital. Yeah.
So if this committee chose to move forward with this today, what timetable are you looking at for an implementation date? January 1?
Yes, sir. You could add it on for January 1st, 2020. We don't charge for the implementation of the program as well. But we would just suggest to actually launch the marketing of the program sometime mid to late January. Once employees have gotten back from the holidays, they've settled in. That would probably be the most effective way. But it could be ready for a January 1st effective date. Yes, sir.
Questions? Yes, ma'am.
Million questions. So how are you going to measure the effectiveness of this program? So how will we be able to know, do we continue this moving forward, and can we opt out if we don't see the success?
Yes. It's going to sound like a really bad answer, but I don't know of any client that's opted out of our program once we start to work with them. So we provide reporting through Cigna. We will show you how many people who have enrolled into the program, how much weight has been lost thus far, the level of engagement in the program. Right now, our participants engage into the program about 31 times per week. So we'll let you know the engagement rates of the employees, how many people were eligible for the program, how many weren't. If you would like us to, we can work with Cigna and the county to develop like a personalized rejection notice if someone isn't eligible for the program because they already have type 2 diabetes. We can help drive to other programs that you all have established at the county. So we will let you know on a monthly basis what type of reports, what the production is. So how we capture that is that we're collecting all the data on our participants privately. And then they're weighing in on the scale that we send them. Again, we provide every single participant a digital scale with a cell phone chip in it, which enables them to step on the scale, communicates it to Amada and privately into their profile. So that's how we're able to capture what their weight loss journey is. Is that right?
Yeah, the only thing I'll add is that, like you said, we conduct an annual review of claims and savings and utilization. So this will be part of that annual review that will demonstrate the, call it a return on investment, to show you how successful it has been, how much weight's been lost, and extrapolate what we think the savings from this program has actually generated. Okay.
Okay, so if I understand correctly, what you're saying is there's no additional cost for this new program. So based on the results of the program, weight loss and stuff, which is going to reduce our expenditure.
Yes.
What you're basically doing is you're taking a little bit of the percentage of savings so if there's no savings, there's no additional monies.
Yes, I think I can answer that question properly. I guess the best way to answer that question, if you look at the actual cost, the claim that comes through, there are 2 preventative claims that come through from this program, and they're listed on slide number 8. So there's a one-time enrollment fee, and that includes the digital scale, the shipment of the scale. We don't charge for implementation of the program. So I always just kind of think about that as like the visit to the doctor, because we're an online hospital, if you will, a provider of healthcare. So that claim comes through as a preventative claim. From there, where money is being charged is before a participant starts the program, we get their baseline weight. Every single month, we take a look at their weight loss, and from there, we charge $13 per 1% weight loss, which you see from at the bottom here. If a participant does not lose weight, we don't charge. And if they lose 1%, then we charge $13 per 1% weight loss the first year. The second year is only $8. So again, it kind of aligns us with the financial stakes of a client that, we're not charging a PEPM fee, a per member fee. It's only for people who are actually, quote unquote, successful in the program.
Are you charging the plan, or are you charging the individual?
Correct. The plan, yes. Yeah. It's all built through claims and a preventative service. Yeah.
That's based on the people who are participating, not based on the people that are enrolled in the overall plan.
Do you want me to kind of go through the return on investment, or?
No, just go on to the.
Okay. So if you turn to slide 17, Paul had mentioned that as Cigna was doing their due diligence and they were looking for the proper vendor to work with, they did some claims analysis. What they saw from the Amada program, if you look, it's the slide here, toward the very back, I think it's slide 17. After the cost of the program, they saw a return on investment of $424 to $972 per participant that went through the program. That's after the cost of the program. So what we simply do is we take, on the next slide, the number of participants we would expect to get enrolled into the program, which is around 412 participants. We think we could get more, but I think it's a really great starting point. We multiply that by the smaller number of that claims analysis, that $424, that 2-year savings after cost. And we believe that the potential ROI, return on investment, for implementing the program would be around $175,000. So.
Lois.
Paul, do any of your other customers who use your point system include this as an option to get points towards their wellness?
Yes, very good question, almost as if I told you to ask it, but I didn't. Yes, our Motivate Me platform has the ability to add an OMADA goal, which you as a committee could decide to add and possibly put a point tied to it or something of that nature. There's 2 ways to achieve a goal that we can set up. Both of them are a little bit custom. One is you could say anyone who completes 8 out of 16 weeks, that's half of the initial program, could get an award. Anyone must complete all 16 weeks. That's one way to do it. Or number 2, or you could do both, achieve either a 5% weight loss, and when you do, your point shows up, or achieve a 10% weight loss and your point shows up. So all those are options that you as a committee can discuss when this is implemented, and add that to the campaign.
Other questions? Mary?
May sound really simple-minded, but I still can't get past the cost of this. The first year, if I'm to go on it, I've got, and I'm saying I realize it's a charge to the plan. It's just easier to say I.
Okay.
So you're going to charge the plan $235. Okay, so now Mary's enrolled. I lose 1% of weight loss, so now we've got to pay $13 for Mary's 1% weight loss. Don't get me wrong, all this is wonderful to lose weight. So that makes sense, but then you get over here and then it's $8% for the second year. So if I lose 20% that month, wouldn't that be wonderful? That's $160. It costs me being the plan,
Sure.
that's a lot of money. For there not to be, I mean, and I get the admin cost, and honestly, I was looking at it and I'm thinking, okay, this might be good, but where you got me is you exclude the diabetics already. Can't find that piece of paper. So I realize Cigna has some other things for the diabetics, but that's a whole lot of money and a whole lot of hoping somebody gets enrolled, okay? Now, not singling out anybody, but there is a part of our population that we're still copying the online test for them to fill out so they can get credit for doing their online test, or they come see Mary to do the open enrollment, or go to the insurance office to answer their questions. So potentially this is penalizing my folks that don't, and believe you me, there are folks that don't have access to a computer. It's not accessing to a phone. It's not accessing a phone or a computer. So that's just my thought. This is, I get it. It would probably work great for 75% of our population, or maybe even more. But you still got some that it won't help at all. So how would we get it to them? And I'm not singling them out, but they could potentially be some of the ones that would need it.
Members, I think most of you have a fairly good idea. If you want to move forward, I'll need a motion. If you choose to think about it, you can defer to next month and think about it, or you can take no action at all and it goes away. So it's up to the committee. Ms. Nolan.
I just have a question because of who I live with. If they achieve that weight loss, that 1%, let's say in month 3 of this, that's when it starts, right? The charge starts?
135 would start when they are registered.
Okay, I'm assuming that's already done.
Yeah, the $13 would start after the 1%. Yep.
What if month 6?
Getting it back? We wouldn't submit any claim or charge for that participant.
It's still based on your baseline. So your baseline's never going to change.
Yep.
So you'd have to go back and get back under that first level that you were already rewarded for. No. Not until you lose weight below your baseline. Yeah. And to pay $160 for someone to lose 20% of their weight loss, I would sign up for that. You would too.
But also, I mean, but the cost savings is the amount of the reduction of claims that you're paying if they wasn't. So, I mean, I see the benefit, but also, too, of the 25% of the people that she refers to, there's some people, there is no incentive. I mean, whether they have access to or not, I mean, there's just some people that choose.
Some people we can never.
There's some that want to, but, sure, have a hard time, But, but what I'm saying is, though, is that we've got to focus on the ones that want to make that commitment, make that change. And, I mean, the return on that is, I mean, it's really the future claims that you're not going to pay out. that's where you got to look to, it's fictional, but you got to look to say, okay, here's what we potentially could be paying out, but because of this program, you're paying a smaller amount than what you would be paying, if the program wasn't in existence and they wouldn't.
That was proven through our pilot study and through the CDC study. So they know based on these amounts that the return will occur if people are losing that weight.
Because it's around, for every new case of diabetes, it's around $12,000 to $20,000 per year for a new case of diabetes typically, so.
Yeah.
Yes, sir.
So Paul, I'll ask you, you're pretty comfortable that we could see an ROI in that 1.5 to 2?
I am comfortable, yes, I'm comfortable.
Mary?
I'll make a motion that we just totally just forget about it. Now, if Paul, you can get some better numbers and dumb it down for me.
What do you need, Mary?
This is not going to help my men.
Okay, so we should throw the baby out with the bathwater.
Well, but what if the biggest part of the population that needs this can't utilize it?
Well, you're no worse off, right, for giving it to other people. That's one thing I would say. Number two is if you do an OMADA goal, we offer an alternative. So they could get a 1 point by offering an alternative method, by seeking a visit with their provider to talk about weight loss, okay? And it would be the same as this program. We have to, by law, offer an alternative, okay? So that would be in place with that. Putting this program in place for someone that has zero electronic capabilities, which I find hard to believe, but you say they're there, it would, I don't think there's any paper. It's all digital. The scale, they could do the scale, but they won't get anything out of it because they can't do the lessons. But for those rare instances, we've got face-to-face coaches that can help.
Okay. I'll change my mind. Defer it to next month. Bring me back, because I see the savings. Give me a for example. Dummy it down. For example, if it was Mary, okay, and I did this, what's it going to cost me first year, me being the plan, and the second year? Then also bring to us how the small percentage that's not feasible, how could we help them with what we have already? Is that reasonable? Okay, I'll make that motion to defer, please.
Okay, you want to repeat that? No, I got it. Your motion is to defer till next month. Is there a second? Motion and a second to defer for 30 till next month's meeting. Jeff, yes.
What happens if, like the first motion said, we forget it? Shouldn't it still go? What's the department's recommendation? Do they have a recommendation on this? That's what I'm asking. Where do we go from here? Excuse me for being so blunt, but I don't know why anybody would be against it. You guys may see something that I don't see, but I don't know why anybody would be against something that could have such a positive impact on a high number of people. I don't get it. I could be wrong, but I don't see any need in deferring it. I think it ought to move forward. What's the department's recommendation?
Commissioner Phillips, I like the program. I know that we're looking at people pre-diabetes, but I like the program just like Healthy Babies programs and other programs that Cigna puts out there, and trying to educate people, help them live a better lifestyle. So that's why we wanted to bring it before you. I didn't think it was something, you say, can we change the plan? And we didn't want to. Paul, there was question even whether or not it needed to come before the committee, but I said, yes, it definitely does, because it goes through your claims and not an administrative cost. So that's why we wanted to bring it before you to take a look at it, but anytime you can spend $1 and get more money back on your investment, lower your claims, I'm all for it.
The mayor's office have a recommendation?
I defer to the department. I just wanted to present it to this committee before we take it forward to the commission, but I think it's important.
I'm new, so I mean I'm coming in this really looking from the outside. But at first I was somewhat skeptical of this, but after I've kind of read into it and listened to this discussion, so basically we're not paying in per every participant. It's the only people who want to participate.
That's correct.
So really, I mean, the people that we're referring to that need it but really not motivated. I mean, I feel like we owe this to them because, I mean, we're never going to capture a reduction on the insurance cost or claims if we don't put something out there for that. Because if it's just more self-motivated, okay, I'm going to start running tomorrow. I'm going to start doing that. It's not happening. So they're borderline now. So they're moving into that higher claim area. I think this is something we need to do.
This is like you said, Alan, so many people, just like after New Year's, they say, I'm going to the gym and I'm going to start losing weight and et cetera. That lasts about 30 days. You can go to any workout area, gym, and you see it. It's packed in January, and then the numbers just start getting slimmer and slimmer. But this is an organized, structured opportunity for those employees who could be borderline and what it may cost our plan later on down the road if we can do preventative stuff on the front end. That's why I wanted it to be presented to the committee. But Lois, I do have a motion to defer, but I'll let you go ahead and comment.
I just have one quick comment. Again, this is for the pre-diabetics, because once you're diagnosed with actual diabetes, you're getting other medications, other things that are going on that you actively have to manage your disease. In this particular case, with an ROI of between 1.5 to 2.1, that's a significant return on our expenses that would run through the plan. And Paul, I don't have any consultative analytics in front of me right now, but we have a large proportion of our population that is already diabetic. And so I would assume, therefore, because of our demographics, that we also have a large population that is approaching being diabetic.
You do. We don't have the exact numbers. Now, Nick did put together the kind of a pro forma of what he would expect, 400 and so to enroll in the plan, but there's a large number. And, when you were on in the risk management office, we highlighted the amount of diabetes that we're spending, the amount of money that we're spending on diabetic patients, and that is something, this is one program that can kind of address that, catch them before they get to type 2. And it's going to be...
If you're assuming 472 would enroll, that means the universe is probably 3 or 4 times that size, correct?
Yeah, on average.
Or the prospective people that would
it's
need
about
this
40
program.
to 60% of a population,
So
typically.
if we were in some capability of trying to educate this, if we were to approve it today, we could get them educated through the open enrollment process and hopefully increase that enrollment. Is that possible?
There are quite a few things we can do to help awareness of the program. We can tag on to your wellness fairs if you would like us to be there. There's just a lot of different outreaches we can do, print-offs, flyers, whatever it might need to be. So.
My comment, I would support this as well.
Ms. Crow.
I have a couple of questions before I'm willing to vote yea or nay. The first question is, if a person enrolls in this program and it doesn't work out for them, like they don't like the interface or whatever, and they send the scale back, do they get refunded the $235, or is that just a loss?
Well, they don't send the scale back, and it's the $235 is not refunded. No.
The second question I have is, do we actually have a gap in service here for people in Rutherford County, for our members, between our wellness coach and Midpoint clinics and our nutrition coach and all these other services that we currently offer? Do we have a gap in service where we need this? Or are people who are pre-diabetic, do they already have service through other means that we're currently providing for our Rutherford County employees?
Okay, back on the motion to defer. We're going to do a voice vote to defer for 30 days. All in favor? I'm sorry? Yeah, motion to defer for 30 days. All in favor signify by saying aye. Aye. All opposed? No. That's pretty close. I'm going to rule in favor of the noes, but I'm deaf in this there, so I think the...
Motion to move forward.
All right. I've got a motion to move forward, to opt in. Is there a second? Motion and a second. All in favor signify by saying aye. Aye. All opposed? No. You can call the roll.
Which one am I?
Call the roll to opt in.
Motion to opt in to the AMATA program. Preble Acton, Rhonda Allen, Andrea Anthony, Jim Bowles, Amber Brown, Christy Crowell, Mary Hickerson, Deborah Kennedy, Lois Miller, Alan McAdoo, Jeff Phillips, Doug Bodery, was that a no? Okay, thank you. Shantae Sherrill. Oh, sorry, Mr. Farley, and Alan Farley.
We have 5 noes and 4 yeses. So we're back to...
Move to forward it on to the steering committee without a recommendation.
Got a motion to move forward to the steering committee with no recommendation from the insurance committee. Is there a second? Second. And a second?
Who seconded?
Mr. Farley. All in favor signify by saying aye. All opposed? No. It fails. Okay. Any other motions? I'm sorry?
Is there any way we could reconsider Mary's motion?
You can make another motion to defer.
I would like to make a motion to defer pending more information presented at next month's meeting so that this committee can actually make a recommendation to the steering committee.
And so you guys remember what Mary said? Okay. All right. Motion to defer 1 month. Second. And a second.
Has it come from the winning side?
They were on the... She was on the winning side. You...
Yes.
You don't know when that original motion?
To defer?
As a voice vote. On the last roll call vote,
Voted no to opt in.
you voted no to opt in, so she would...
I'm talking about the first motion to defer.
Yeah, that was by voice vote.
Yeah, so we cannot reconsider that motion.
Not that motion. That is correct. But you made a new motion, right? You're making a new motion to defer. And a second. So we're back on that motion.
Is it the same motion, Mr. Chairman?
Well, I think your motion was to come back to bring...
Right. My understanding of what just happened is that we voted down deferment, then we voted no on moving forward.
That's
right?
correct.
Which means that now it's dead in the water. So we will never reconsider this. And I don't like that.
Reconsider hers, but I'll entertain a new motion from you.
Right. So now, instead of dead in the water, what I would prefer is a deferring until next month so that we can revisit this with more information. Because ultimately, I would like
So that still keeps it alive, yeah.
I'm sorry. I would like to make a motion to defer to next month.
Okay.
Considering this program.
To consider the program, not to reconsider, but to consider the program. Okay. Got a motion and a second. All in favor signify by saying aye. All opposed? Motion carries. It'll come back next month. Thank you, gentlemen. Appreciate y'all. Who was the second on that motion? Mary? Okay. Very quickly, we get down to other business. I want, in the vein of being transparent, I want to share with this committee before I make a presentation to public safety on Monday. But David Patterson is our new property and casualty broker out of Franklin, and I asked him back in July, right after he was awarded the bid by this committee and the full commission, to look into our volunteer fire departments. What I'm telling you today is that no action has been taken regarding the volunteer fire departments, but I did meet with them, Mr. Elam, Mr. Patterson, myself, and Pettis Reed, Chairman of Public Safety. We met with the volunteer fire departments because during the evaluation of looking at the bids, it was discovered, looking at all the policies of our volunteer fire departments, meaning the four, Eagleville is excluded because they say they're a city, but the four, and we're giving the county commission up the ante for our volunteer fire departments on an annualized contribution from $50,000 to $60,000 to help offset their insurance program, and that's been in place for some time, Jeff. So I had a chiefs meeting, and they all attended. What David discovered in looking at their programs, who have a separate policy, we have, David, 8 pieces of property, or 8 pieces of equipment, and 4 pieces of property that are doubly insured, meaning that we own most of the buildings of our volunteer fire departments, and we own most of the equipment that's been given to them by the commission in years past. So we found out that they're double insured. They're paying for it, and we're paying for that same piece of equipment. They're paying for a building, and we're paying for a building. So we think that we can add all of the contents, the buildings, the equipment, pick up the professional liability for the directors. We can pick up the workers' comp. We'll take out a separate policy for their employees. We'll pick up their accident insurance that's being carried and still save them money. The caveat is that the county carries a higher deductible. On our property, we carry a $100,000 deductible. On the vehicles, we carry a $25,000 deductible. So what I've asked them to consider, to go back to their boards, to consider opting in and letting us provide that coverage. But they will have to give me, not me, but the county back, and we put it into an escrow account, Lisa. Almaville's paying $33,000, okay, for their insurance package. Christiana's paying $13,000. So we would need that money to set aside and hope nothing happens in the first year or two, put it into that escrow account to offset any deductible that we might get hit with, okay? But long term, it's going to end up providing better coverages, broader coverages, as well as saving them money. And so they left the other night, the 4 chiefs that were there, left the other night feeling fairly good about it. You know, when you deal with volunteers, it's different than a paid department. Like, we have a paid department in Rutherford County, but we still need our volunteers because we can't afford to pay to cover the whole county. So long term, if we're looking at the bigger picture, this is actually going to provide better coverage for them at a cheaper price, and at some point in time after a couple of years, we can start giving them more money to buy more turnout gear, more air bottles, et cetera. So I just put that on your radar before. I didn't want you hearing about it secondhand. You're the insurance committee. I'll take it to public safety Monday night and make that same presentation. I did emphasize, not once, but several times, this is a no attempt for us to take over any of our volunteer fire departments. That's been the biggest issue over the previous years. I think we're taking them over. That is not the case because we need volunteers. We just, you know, what happened in Fosterville, the board in Fosterville chose to just get out of the volunteer business because they didn't have enough trained firefighters to fight fires in that area of our county. So they emptied their bank account, and we owned the building anyway and the equipment except for a brush truck, and so they just turned it over to the county, and we assumed it because that's our responsibility to provide that fire protection in that part of the county. But this coverage, it's going to be, everything's going to be covered just like they're covered today. The fish fry, if you recall, they had some issues on some tainted beans and sent some people to the hospital. Those coverages are the same as what they have today. So we picked that up. Mary?
Just a quick question. So instead of each volunteer departments, the 4 of them, paying their $33,000 or $13,000 to an insurance company, they're putting that in an escrow that will be every year, and their escrow would build. So when Anvil puts in $33,000 next year, they put in $33,000. So when Anvil has a problem, it'll come out of their $33,000.
Well, that'll be up to the commission at that point in time, but they're paying it to a third party now. As it is, they're paying that same amount of money. We're just taking it and put it in there and providing better coverages for the directors. Some of them don't have directors and officers or professional insurance. The umbrella will extend over. We'll take out a separate policy because we have OJI. This will be a separate work comp policy for those firefighters on the volunteer basis. But eventually, I think that we can end up giving them more money back than what, and we gave them another 10 this year on top of what they were already getting. So that's just a FYI, letting you know where we are before we go to public safety, to let them know. And then they're going to come back. We'll have another meeting with the fire chiefs to see what direction that they want, if they want to opt in or not. Okay? I think Jim got up and left. I wanted to recognize him. This was his last meeting as a at-large member of this committee. How many years has he been on the committee? Does anybody know? But we'll send him a thank you letter for his service, serving on this committee.
He said he got another meeting.
Okay, well, we'll send him a thank you and maybe get everybody to sign it next month. And Mary, happy birthday. You want us to sing happy birthday to you? We didn't bring a cake or candle or anything, but we say thank you and happy birthday to you and many, many more. Anything else to come before the committee today? Seeing none, we'll stand adjourned.